trend in facelifts, and knives are not a part of this procedure.
Cosmetic surgeon Scott Miller is here to tell us what's new about the contour thread lift. Well, welcome to our show. First of all, why does skin sag as we age?
Well, it's a combination. What happens is it loses its structure. Like all things, it slowly stretches and breaks down, and so then it just is less elastic and doesn't have that snap back.
Yeah, we want the snap back.
We like the snap back,
So traditional plastic surgery, they cut you all open and they pull you all back. What is a thread lift?
Well, and it's not just they, it's me too. So I take part in that. You know, traditional techniques with contemporary advances are great, and they provide a really definitive result when they're in the right hands. What a thread lift offers is the ability to non-incisionally, in other words, without a cut, be able to produce a modest natural elevation and lift of the face and the different areas of the face, you know, without an anesthetic and without a big surgery. Now, that's not to say it replaces the old techniques, but certainly for people who aren't ready for a facelift, for people who don't want or can't have a facelift for medical reasons, or people who have recurrent signs of aging after surgery years ago, this offers, you know, a less invasive, less involved solution.
Now, what about the results? They're less dramatic than a traditional facelift?
Absolutely, and that's part of the good and part of the bad. This, again, this isn't going to replace, for people who need kind of total facial rejuvenation or who want that, this isn't going to meet all of their goals and needs. But for people who have those early signs of aging or early signs of recurrence after surgery years ago, this is going to produce that modest support, and it allows people to be proactive about their aging so that they don't have to wait until there's going to be a night and day difference. And a lot of people don't want to come in one day to work looking like a different person.
Here we are, one of your patients.
Yeah, what is different about her? How did this help her?
You could see where it gave her support, or hopefully you could see where it gave her support is in the cheek, the smile fold area between the nose and the corner of the mouth, and along the jawline. And that's really what she wanted help with. Her brows looked good, and her neck, she had a little bit of fat right under the chin, which she didn't want to address right then.
Yeah.
But what
Why
it
did you
did
look at me
give
when
her,
you said that?
neither of you are ready for anything. But what it did do is it gave her the ability to address those early signs of aging in a truly minimal way. In the past, what has been termed a mini facelift hasn't been mini at all. I mean, if you have to make the whole incision, I don't see why you don't do the whole deal, you know. Whereas this, if you're going to get kind of a modest or a modified result, then it certainly ought to be a simpler process, and that is what this gives us and puts into our armamentarium.
Now, I understand the patient is actually awake during this procedure.
Talks to me.
You don't knock him
no
out?
anesthetic.
Ooh.
If you don't make an incision, though, how do you lift anything up?
Well, what you do is it's multiple threads, the same sutures that we use in facelifts.
And you just happen to be carrying one of those in your pocket?
Just happen to be carrying one of these in my pocket. It's so little. Let's see if I can grab it out for you. But basically, you place these little threads. I don't know if you can pick that up, and
Like
you can feel there's little tiny barbs on it. And so what happens is, rather than just basically what it does is you place these, you just poke them in, and you place them, and it's user dependent. It has to be done right, it has to be in the right layer and the right plane. But by placing them in certain locations along certain pathways, you can get the lift that you need for the soft tissues of the face. Now, obviously, if there's a ton of skin, then it's got to go somewhere, and you're going to have to take it out at some point. But for more modest excesses or laxity or sagging, this can do the trick.
Cost. How long does it last? Yeah, and cost.
It generally lasts, what we see is there's two ways to look at how long does it last, you know. Basically, when do people come in and start seeking either this procedure again or more definitive procedures. Generally, people seem to get 3 or 4 years of support out of this. It satisfies their needs. Now, whether in 3 or 4 years they want to do this again or they want to do a more definitive procedure because now they feel like they're either mentally or physically ready. And so it gives them that. Basically, though, I mean, the lift is there forever. You just continue to age. So 3 or 4 years later, you've reaccumulated that aging.
A little more.
And is it cheaper? It's a lot cheaper, I would imagine.
It's about half the price for any equivalent area, whether you're talking about the brow or the cheek or the neck. It's going to be about half the price when you look at the total. Because, again, you can do this in a procedure room. You're not really in a formal operating room, and you're not having to undergo anesthesia. So there's a lot of other savings. So at the end of the day, it's about half the price. You know, it's still not insignificant, but it's about half the price of what you're looking at the alternative way.
Work next day or
Absolutely not. This is an important thing, is that you feel great the next day because the whole procedure was under local. And you can certainly get a lot done around your house, but you don't want to be chewing heavy things, you don't want to be really animated, and you're not going to want to have a lot of social contact for the first 5 to 7 days. you just want to let everything kind of settle down. By a week, you're out and about doing pretty much everything, and by 3 weeks, you know, you can be back lifting weights, working out, doing aerobics, and everything else. So that's more the process.
Wow.
Is there bruising at all?
There, I would say in 3 out of 4 that I do, you'll see no bruising, and in 1 out of 4, somebody might, when you poke somebody with a needle, some people get a bruise, and nothing takes that fact away.
Fascinating.
All right. Interesting. The thread
Contour
lift.
thread.
Yeah, appreciate your time. Thanks,
Oh,
Doctor.
it's my pleasure.